I wish I would. But she has a job. Oh, was she? Childhood, yeah, childhood college. Yeah. Where tons used to be. HISD, right. They got several of those locations.
Ladies and gentlemen, the program will be beginning shortly. Your seats. Ladies and gentlemen, please take your seats.
Yep, I can hear you. Can everyone take your seats, please? We'll get started in a moment.
From Maine.
Oh, it's on?
Between Oakland and
Where are your
Maine.
remarks?
Shamrock used to be.
Oh, you're here.
It's too loud.
They don't have to speak. I'm like, what?
Buddy? Press conference. Dr. Gary Puckrin, President and CEO of Minority Quality Forum.
Good morning. I am Gary Puckrin, President of the National Minority Quality Forum. I want to thank you for joining us as we stand in full support of President Biden's Cancer Moonshot initiative, which aims to reduce cancer deaths by 50%. This call to action is not just a significant endeavor, it is also central and critical cause that demands public. 60% of Blacks live in a community where one or more abandoned toxic waste sites. 3 of the 5 largest commercial hazardous waste landfills are located predominantly in African American and Latino communities. Second, in these communities where public policy has elevated the risk for cancer through exposure to hazardous waste, public policy has also denied them access to the best modern cancer care. There's been substantial progress in cancer treatment, screening, diagnosis, and prevention over the past several decades. But communities marginalized by lower economic status and environmental exposure are slow to see the benefits. Rural white communities tend to exhibit higher cancer death rates, less frequent use of proven screening tests, and have higher rates of advanced cancer diagnosis. Statistics reveal that blacks have the highest death rate and shortest survival for most cancers. Cancer screenings is disproportionately lower in Hispanic, Asian, and American Indian communities when compared to affluent communities. Pent-up frustration in medically underserved cancer care communities have eroded trust in their healthcare system, leading to the late-stage diagnosis of cancer. These inequities are the result of complex interplay of economic, cultural, and environmental factors created by failed public policy, rendering routine cancer screenings and advanced cancer care inaccessible to far too many Americans. This state of affair is unacceptable. We echo President Biden's call to action and emphasize that achieving the vision of the Cancer Moonshot requires urgent and sustained attention to cancer disparities. Today, in partnership with the CEO Roundtable on Cancer, the White House, NMQF announces a groundbreaking multi-year, multi-state initiative. This initiative aims to deliver advanced cancer diagnostic technology and state-of-the-art follow-up care to medically underserved cancer care communities. Our report outlines decade-old policies that have led to this disparate and shameful state of cancer care in our nation. While the journey to achieve the goal of the Cancer Moonshot will be arduous in marginalized neighborhoods, victories in these communities' streets will demonstrate our collective capacity to shape our future. Our government was organized to conserve life and to treat each life as equal, inherent, and inalienable. By coming together, we take the next step in the journey to perfect the American dream. Learning how to provide beneficial care to all is not a moral obligation, it is a contractual obligation, a promise we made to each other. And so together, we begin writing the last chapter of the bipartisan, intergenerational battle against cancer. I want to thank you. I want to ask each of the speakers when they come up to identify themselves. Thank you so much.
Hello, I'm Otis Brawley, professor at Johns Hopkins University, and it's my privilege to represent the CEO Roundtable on Cancer today. For far too long, certain communities across the United States have suffered limited access to cancer care, indeed health care in general. This includes not only medical treatments, but also the tools for prevention, appropriate screening, appropriate diagnostics of cancer. The issue is not just a public health problem, it is a civil rights issue, as all of us have a right to a long and healthy life. The CEO Roundtable on Cancer has already begun to address this issue through its CEO Gold Standard Workplace Accreditation Program, as well as its Going for Gold initiative, which works with minority-serving educational institutions across the nation. The Roundtable has joined forces with the National Minority Equality Forum because we recognize that these efforts can't be limited to the workplace or just to the campus. They must touch every part of our lives. We must get health promotion into every aspect of our lives. These connections are essential to building trust and developing lines of communication that will be necessary to address these long-standing issues of health inequity. This report to the White House is the first step in what will be a long campaign to reduce inequities in cancer care. It's my pleasure to now introduce Dr. Danielle Carnival and thank her for all the hard work she has done in promoting health and health awareness.
Hello, thank you, Dr. Brawley. That was very kind. My name is Danielle Carnival. I am the Deputy Assistant to the President for the Cancer Moonshot and Deputy Director of a Health Outcomes Division in the White House Office of Science and Technology Policy. Thank you for having me, and thank you to NMQF for bringing together this important conversation and body of work. When President Biden and First Lady Dr. Biden reignited the Cancer Moonshot early in the Biden-Harris administration, addressing inequities and reaching more Americans with effective cancer prevention, early detection, and treatment was a central focus. This built off a commitment from the president on day one, putting equity as a central priority for all of the work across the full expanse of the Biden-Harris administration. And the president and First Lady set bold goals for the reignited Cancer Moonshot: to decrease the cancer death rate, as Gary said, by at least 50% over the next 25 years. That effectively means preventing 4 million American cancer deaths by 2047. And to boost support and improve the experience of patients, families, and caregivers as they go through their cancer journey. The president made it a central part of his unity agenda, issues we can all get behind to make progress on together for the American people. And he brought together a whole of government response in the first ever cancer cabinet. This includes everyone from the Departments of Health and Human Services to Defense, Veterans Affairs, Energy, the Environmental Protection Agency, and many more. And we've made great progress with more than 50 new federal actions across 5 priority areas. These are close the cancer screening gap. We mean the gap that was exacerbated during the pandemic, but we mean the one that we know was inequitably accessible even before the pandemic. To understand and prevent environmental and toxic exposures, to decrease the impact of preventable cancers and prevent more cancers before they start, by reducing tobacco use, making sure everyone has access to healthy food, and getting more people vaccinated against HPV, among others, by bringing cutting-edge research and care to everyone across the country. So we need to drive more innovation, but we need to make sure that that is accessible to more people in more zip codes, and to support patients and caregivers by helping them navigate the many decisions associated with a diagnosis, providing patients easy access to their health information, and driving action to lower drug costs. As a powerful platform for change, the Cancer Moonshot also spurred more than 100 private sector companies, institutions, and organizations to join with new actions and collaborations towards ending cancer as we know it. Equity when it comes to cancer is when everyone has an equal opportunity to prevent cancer, to find it early, to get proper treatment and support, and follow-up care after their treatment is completed. Data shows, and the National Minority Quality Forum report reinforces, that we are far from this reality. So where do we start? Just to mention a few steps that we've taken. In 2023, President Biden issued an executive order on environmental justice. We have known for far too long, we, as a society, have been willing to put people in poverty and communities of color at greater risk for health issues related to environment and toxic exposures that could cause cancer and other diseases. We are tackling this, for example, through implementation of the bipartisan infrastructure law. Billions of dollars are going to clean up toxic sites and ensure that people in all zip codes have access to clean water and from water free from lead and so-called forever chemicals. The U.S. Department of Agriculture launched a signature new program, the Advanced Research and Implement Solutions at the Intersection of Nutrition and Disease, or the ASCEND program, in support of the cancer prevention goals of the Cancer Moonshot as part of the President's commitment to improve nutrition for the American people as laid out in the National Strategy on Hunger, Nutrition, and Health. The Centers for Disease Control and Prevention provided updated resources to help communities identify cancer clusters, helping states as they navigate patterns of disease in communities, and updated guidelines that place a greater emphasis on engaging and communicating with community members. The CDC committed $1 billion to ensure that every state has access, and tribal communities and territories have access to cancer screening and early detection. This is giving funding directly to community organizations that know those communities and know what kind of outreach will lead to the results we need. Health and Human Services paired up federally qualified health centers and NCI comprehensive cancer centers. So if we do find something in that screening, there is a pathway for someone to get diagnosis and effective treatment. To drive new innovation, that we created a brand new agency in ARPA-H, an Advanced Research Projects Agency for Health, that is driving new progress on ways to prevent, detect, and treat cancer and other diseases. And at the end of last year, we delivered on a commitment from the President's State of the Union to make sure that navigation services for people facing a cancer diagnosis are a covered benefit for Americans. This is just naming a few. And I outline these steps to show the broadness of how we are working to address inequities in cancer prevention and early detection, but we are not nearly done. To reach the goals of the Cancer Moonshot, we need to continue to drive progress, as I said, in new ways to prevent, detect, and treat cancer and survive cancer. But we also need to ensure that the tools we have today and those we develop along the way reach more people. Cancer is personal to the President and First Lady. That is why this is one of the missions of their lives. But cancer is a priority for this administration because cancer is personal for virtually every American family. So you have our commitment that we will continue to work on this with you, and together we can end cancer as we know it. Thank you.
Good afternoon. I am Dr. Letitia Plummer, at-large council member for the City of Houston, and I bring greetings from our mayor, Mayor John Whitmire, and our Fifth Ward residents. I address you today as the voice of Houston's Fifth Ward, a community facing a dire crisis, a cancer cluster that has predominantly affected African American residents for decades. Our people are battling rare cancers, including multiple myeloma and Hodgkin's lymphoma, but also colorectal cancer at 47.8% and lung cancer at 57%. This is a reality that's been confirmed by the Texas Department of State and Health Services in 2019, when it was identified as a portion of Houston's Fifth Ward as a cancer cluster, finding higher than expected rates of different cancers in its 10 census tracts. This is not just a statistic, it is a call to action. For decades, this predominantly African American community has been grappling with alarming surges of rare cancers, including multiple myeloma and Hodgkin's lymphoma. In 2015, local advocates unearthed a disrupting pattern of illnesses, and a subsequent study by the Texas Department of Health State Health Services confirmed our worst fear. The incidence of certain cancers in Fifth Ward notably higher than any other portion in Houston. Fifth Ward exceeds the national standard for carcinogens in any community in Houston. In this critical hour, the National Minority Quality Forum stands as a vital ally, advocating tirelessly to bring essential testing, healthcare resources to underserved communities like ours. Their commitment to eliminating health disparities resonates deeply with our current struggle, emphasizing the urgency of bringing immediate, tangible healthcare solutions to our Fifth Ward. Our residents face formidable barriers, limited awareness, high costs, and efficient access to healthcare. The COVID-19 pandemic has intensified these challenges, with job losses leading to reduced income, loss of health insurance, and further leading to reduced income, impeding the access of life-saving cancer screenings and treatment. These communities have a cumulative effect, We find often that you see cement batch plants, metal and cement crushing facilities in our communities. So there are many reasons why cancer is prevalent in our communities. In Fifth Ward, the absence of primary health care means that emergencies dictate medical interactions, not prevention or continuous care. Discussions about relocations have surfaced, yet we fall short in addressing the immediate and ongoing medical needs in our community. President Biden's Moonshot program offers a beacon of hope with its 7 pillars, particularly in closing the screening gap and addressing environmental exposures. These initiatives align with our urgent needs in the city of Houston. We seek a future where every resident in the cancer cluster has access to preventative care and health care. I stand before you as an advocate for immediate action and a policymaker from the city of Houston. Let's just transform the despair that our Fifth Ward is experiencing right now. People like my friend, Miss Beal, that died last year of lung cancer that could possibly have been prevented. The time is now. We are asking for your immediate assistance to make sure that our communities stay whole. Fifth Ward is the fabric, historical fabric of what Houston has to offer, and I'm so pleased to be able to be in the room with such bright minds, ingenuity, access, and people that want to actually create change for the city of Houston. Thank you.
Do the audio.
with various medical practitioners and at the same time disseminate needed information concerning cancer and other related health issues. With the shared information and encouragement through the National Minority Equality Forum, hopefully our congregation and community will become more aware of the importance of preventive care that may possibly yield early detection and treatment of cancer and other diseases.
Good morning. My name is LaWanda Fanner, and I am a breast cancer survivor. I would like to share my perspective on health disparities as it relates to my diagnosis. In November 2022, I discovered a lump in my right breast, had several exams, and it was determined that I had stage 2 breast cancer. I underwent 16 rounds of chemo and a lumpectomy, as well as 20 rounds of radiation. I rang the bell a year later on November 1st, 2023, and am cancer-free. At the time of diagnosis, I was uninsured and faced challenges in receiving appropriate health care. Through the financial support of my church and community-based organizations, such as Survive Her, I was able to afford all co-pays and cancer treatments. This, of course, is unfortunately the reality for a lot of women who look like me. After my experience, I chose to participate as an advocate at the National Minority Equality Forum's Health Fair, which was held right here at Brentwood Baptist Church. I was able to connect with underserved women who would otherwise not have access to breast screenings and resources. They were grateful for the opportunity to get a critical screening and information that could ultimately change their life. Thank you, NMQF, for this opportunity to share my story and serve as a voice for the voiceless.
Congressman Dan Kildee, directly from my hometown of Flint, Michigan. I want to thank the team at the National Minority Equality Forum and my friend Art Woodson for inviting me to participate in this event today. For those of you who don't know, I recently had my own cancer battle back in March of 2023. In a precautionary scan, my doctors found a tumor in my tonsil. And after surgery and what has been a longer than expected recovery, I am happy to report that I remain cancer-free. But I want to make it clear, thank you. If it were not for early detection, my prognosis could have been much worse, and that is very much part of the work that we're doing here. One of the first calls I received after my diagnosis was from President Biden himself. As was said, this is personal for him. This is a commitment that comes out of his own life story. And I'm pleased that we are embracing this and making sure that as we pursue both detection and cure for cancer, that we include every single person, every single American in that effort. Unfortunately, a lot of Americans don't have access to the kind of preventive services that I was able to take advantage of. And that's why I'm proud to work alongside my colleagues in Congress and the House of Representatives to pass legislation that dramatically expands access to a new form of testing that detects cancer earlier than currently available alternatives. In communities like Flint, people are often denied access to screening they need in order to catch cancer early. Without appropriate testing, cancer progresses, as we know, making it much more likely that they'll develop an incurable form of that disease. In the richest country in the world, it's completely unacceptable that members of our communities are dying because they cannot afford access to testing that they need. So we're together here, and I will not stop fighting until we've closed the gap in cancer care that has impacted communities like mine for far too long. Whether it's helping secure federal aid to expand health care for families following the Flint water crisis, or capping prescription drug prices for seniors, one of my top priorities in Congress has been delivering Flint, my home community, the resources that it needs. So, in my remaining year in Congress, my focus will be bringing more resources home to make our community healthier and stronger. So I look forward to partnering with all of you in that. One of my partners throughout this entire journey, and my fellow Flint Northern High School, I won't say classmate because it was so much after I was there, is the mayor of my hometown, my friend Sheldon Neely, Mayor Neely.
Good morning. I'm Sheldon Neely. I serve as mayor of the proud city of Flint, Michigan. And today I'm thanking God for all of our partners here in the Moonshot program. You know, when we talk about these programs, these are life-saving programs. I lost my mother in 2022 to breast cancer. So I know firsthand how we have to navigate a system that may not always be accommodating for communities like Flint. We today are announcing a program here inside the great city of Flint about how we can come and close the disparity. Living in an illusion of equality as it relates to healthcare is just that, an illusion. The disparities are far and great, and today we're trying to close the gap, especially about early detection, especially in Black and brown communities like the city of Flint, Michigan. And so when we talk about putting our thumb on the scale to be able to give life-saving measures to communities like Flint and other communities across our country, we need to be able to engage this very quickly. We know a level of disparities through healthcare and education and the racial wealth gap, but we understand that poverty is directly related to healthcare and navigating healthcare in our communities. Definitely with this program and the partnership that we have created here now, today, we're going to be able to save lives. And we know that one deficit that we can never overcome, and that's a death deficit. And so we're making the investments now, today, in this community, and I'm so proud of the Flint City Council. There's going to be initiating some additional resources to be able to get people early screening and testing to be able to save lives, especially in Black males who are falling to death through prostate cancer or the lack of screening from this deadly disease. And so today I welcome all of you, and I ask all of you as we celebrate the blessing, and that's what I call it, celebrating the blessing, and we take that first breath every morning, to use that breath and we use that blessing to do something else, to be able to make sure that others can help celebrate this blessing. And then we all can live in the bonus, and that's life. But we can only do so together as a united community. And so it's through a humanitarian efforts like the Moonshot program, we're celebrating the blessing and increasing quality of lives across this country. And so now I would like to introduce the pastor of St. Mark's Church right here in the city of Flint, Pastor Kevin Thompson.
I'd like to thank everyone who has come to join us in this. Arthur Woodson and also our Congressman Dan Kildee, who have come together to try to make a difference in our community. Together we can make a difference. Together we stand, divided we fall. Let's build a bridge and let's tear down the wall. Let us respond to our brother's call. Cancer is running rampant throughout the United States of America. Here in the city of Flint, we have found that there are more people here, minorities, in our community. And so what we have done has come together to try to make a difference. If we can detect it early, we can really help. We can make a difference. Too many people die before their time. And so we thank you for this time. Thank you for being here at the St. Mark Community Outreach and St. Mark Missionary Baptist Church. Together, the time is now. We can make a difference. Here, all of the people, community leaders that we have, council persons, vice president of the board, education. We have a lot of community leaders that's here today. And also we have a breast cancer survivor that is here today. Can you give her a hand, please? Amen. She's here today. Her name is Melissa. And so we have all our community leaders here working together. And together we can make a difference here in America, here in the beautiful city of Flint. Thank you. God bless you.
Hello, I'm Tom Baer. I serve as Chief Medical Officer for Multi-Cancer Early Detection at Exact Sciences. And thank you for the opportunity to share Exact Sciences' commitment to the work that NMQF is leading on health equity, particularly around the most constant and urgent issue, that of cancer. Cancer affects all of us, but as everyone in this room knows, cancer does not affect all of us equally. The disparities in cancer incidence, detection, treatment, and survival are all significant and unacceptable. As an oncologist, every Friday morning I see men with prostate cancer, many of whom suffer from a disease that was detected too late. So I see that impact very personally. We know that a person's zip code can tell us a great deal about their health and well-being. NMQF has brought us all here together because we all agree that where you live shouldn't determine if you live. And so through our partnership with NMQF and the Cancer Stage Shifting Initiative, we have been strategic and thoughtful about access to options in colorectal cancer screening for underserved populations. When the Stage Shifting Initiative first launched, Exact Sciences was proud to be lead corporate sponsor. We quickly got to work, and NMQF identified Flint, Michigan as the initial community to begin this work. Now, Flint just happens to be the hometown of our CEO, Kevin Conroy. The challenges we saw in Flint, the Flint community faced in getting screened for cancer were disheartening and reinforced our commitment because we know earlier detection means better outcomes. Flint served as a blueprint for work to be done across communities throughout the United States. A few months later, we joined the NMQF in Houston to offer Cologuard kits and colorectal cancer education. In Houston, our team learned that patient hesitance is real, and working with communities is essential to overcome the challenges. We are at an inflection point in cancer screening. We have seen countless lives saved by just a handful of screening tests, but most cancers are still diagnosed too late and have no screening options. Today at Exact Sciences, we're working to develop future tests to detect many different cancers early. We see a future where most cancers are detected at early stages, when treatments are effective and cure is within reach. As new technologies expand options and access, it is critical that policies keep pace with innovations. Exact Sciences looks forward to working hand in hand with the NMQF to ensure that new screening technologies do not exacerbate existing inequities, but instead democratize access to earlier detection of cancer. Thank you very much.
Good morning. My name is Kathleen Mignon, Medical Executive Director at Genentech. Thank you for having me. It's an honor to stand here on the shoulders of my colleagues who have championed this work long before this was deemed important by the majority. At Genentech, we envision a healthcare system that is diverse, inclusive, accountable, and trustworthy to patients. To achieve this vision, we aim to integrate a focus on health equity in everything we do, from the design of our clinical studies, to the access and policy priorities, to our medical workforce, to the investments in the communities that we serve. We collaborate across industry and with the communities that we serve to ensure all of us thrive. By working together and building deep and sustainable partnerships with critical stakeholders across the healthcare ecosystem, including industry, government, researchers, advocacy organizations, and the communities most harmed by the systemic inequities in healthcare, we believe we can make progress towards advancing health equity. We're committed not only to be a health equity leader, but we want to be a partner of choice because we cannot advance health equity alone. Therefore, we're working to co-create lasting solutions that address the manifestations and the drivers of inequities in healthcare, from education to care delivery. For example, we're working with the National Minority Quality Forum to advance cancer equity in Flint, Michigan through their Cancer Stage Shifting Initiative. In this initiative, we're working to combine the collective leadership of Flint community-based organizations, researchers, clinicians, and community leaders to improve cancer outcomes. More specifically, through this collaborative effort, we're working to provide educational resources to the Flint community to really address insurance enrollment and expand access to care. We're also raising awareness about the importance of cancer screening because we know that early detection has a positive effect on outcomes for all patients. We take a top-down and a bottoms-up approach to investing in collaborative efforts that center the needs of historically underserved communities. And that means solutions-oriented collaboration with local leaders and policymakers in order to affect change. Our health equity policy priorities include increasing access to biomarker testing, increasing the diverse representation in clinical trials, and strengthening the 340B program to maximize patient benefit. This is in addition to engaging with over 500 patient advocacy and community-based organizations to co-create transformative and community-driven solutions to long-standing inequities in healthcare. We know that eliminating health inequities will not happen overnight, but we are committed to the long haul, and we look forward to working with many of you to build a healthcare system that meets the needs of all patients. Thank you for having us.
Good morning. My name is Dr. Michael Greenberg. I'm the medical head for Sanofi Vaccines in North America, and it's really an honor to be here to talk about the importance of vaccines, cancer, and health equity. And you're probably thinking, vaccines and cancer? Well, it should be no surprise that cancer patients have an increased risk of infection given their treatments and their altered immune systems. Cancer patients, for example, face a 1.5 times higher mortality rate from influenza when hospitalized during the flu season. Recognizing this, the CDC, the ACIP, the American Cancer Society provide immunization recommendations for both cancer patients and their caregivers. Immunizing close contacts is also vital, creating a protective cocoon around cancer patients lowering the risk of exposure to infections. And this is especially important for healthcare workers. And when it comes to cancer care, removing uncertainty is always a good idea. Flu seasons, however, are unpredictable. Last year in the US, flu caused up to 54 million illnesses and 58,000 deaths. And while anyone can get the flu, we know that there are certain groups that are at increased risk of flu-related complications, including patients with undergoing cancer care with impaired immune systems. Unfortunately, gaps exist in coverage for flu and other vaccines. Black and brown American seniors are about 30 times less likely to get a flu vaccine, and despite Medicare coverage, are still less likely to get a higher dose flu vaccine, which is recommended for this age group. At Sanofi, a leading vaccine manufacturer and supplier, we remain committed to working to reduce gaps in influenza vaccine disparities through continued support of our advocacy partners. And on behalf of Sanofi, I'd like to applaud our longstanding partner, NMQF, and the work they do to engage local, trusted messengers to educate, motivate, and ultimately vaccinate people to improve access and to improve their lives. The Cancer Equity Moonshot Initiative brings the focus and experience of NMQF to bear on the challenges of cancer, addressing influenza and other preventable diseases through immunization underscores NMQF's commitment to enhancing the overall well-being and opportunities of individuals, ensuring that everyone has access to has the chance to be as healthy and as productive as possible. And finally, let me re-emphasize the need for all of us to be up to date on recommended vaccinations, including our annual flu vaccine, not only protect ourselves, but also the community around us, especially the most vulnerable. Improving health equity and vaccination and cancer care is a collaborative effort, one that we all have a part in and are fully aligned with the overarching goals of President Biden's Cancer Moonshot program. Thank you.
Good morning. I'm William Lawrence, Chief Medical Officer at Carolina Complete Health. I'm humbled by this opportunity to be here today and present on behalf of our parent company, Centene. Centene Corporation is a managed care company that provides health care to nearly 1 in 15 individuals nationwide, supporting low-income and vulnerable populations that have too often been underserved by the healthcare system and for whom access to care has historically been a challenge. We do this through government-sponsored programs, including Medicaid, Medicare, and the health insurance marketplace. And we have extensive experience navigating the care journey with low-income, diverse, and medically complex populations. Our core philosophy is that quality health care is best delivered locally. This uniquely local approach means that our employees not only reflect the diversity of the populations that they serve, but we also live and work in the communities that we serve, and this is essential to the impact that we can have. This is why we're really happy to be a part of this event today. We're thankful for all of these collaborative partners here for your dedication and the optimism that you all are bringing to this important cause. We know that on our own, we can achieve incremental changes. But when we come together in relentless pursuit of a goal, we potentiate our talents and we can truly surpass our most lofty goals. The time is now, and the work is urgent. It's urgent because we see the full impact and toll of health disparities on the communities that we serve. It's also urgent that because of the pace of innovation in cancer care, we continually see enhancements in the quality of outcomes that we can ultimately achieve, particularly when we connect people with screening, diagnosis, and treatment at the right time. For example, in colorectal cancer, we know Black Americans, we're more likely to get and die from it than our majority colleagues. Centene plans were encouraged to focus on colorectal screening even before NCQA included that as a measure in our health plan rating measure set. That's because we saw the difference screening and early detection could make for our members. Examples of what we've done with Medicaid include sending out at-home screening kits, digital messaging, and incentives for members and providers, all aimed at getting more of our population screened so that we can either have prevention or early detection of cancer. And we will expand those efforts to other markets in the year ahead. In our relatively young health plan down in North Carolina, we are employing those same approaches, and we're also adding the unique resources that the Healthy Opportunity Pilots present in North Carolina for really impacting the social drivers of health that also impact access and adherence. Centene is here to transform the health of the communities we serve, one person at a time. Centene has been a longstanding partner of NMQF, including participating in last year's Flint screening, and we're thrilled to be a part of this cancer stage shifting initiative. Thank you to Dr. Puckering for your leadership, and we look forward to working with all of those here assembled as partners in the pursuit of health equity.
Good afternoon. I'm Michael Mena, Chief Science Officer of eMed. Medically underserved communities are defined in large part by systemically benefiting less than most communities by the scientific advances that have been made and the amazing strides made in medical care and medical delivery, particularly around cancer care, but also, as COVID-19 highlighted, infectious disease, chronic diseases, autoimmune diseases. There's a clear lack of appropriate distribution of the care that runs the spectrum of the healthcare ecosystem, importantly including access to some of the most innovative and important clinical trials, as well as access to the most innovative and cutting-edge technologies and medicines that improve the quality of life and longevity of patients living with cancer today. And at the same time, medically underserved communities tend to have greater incidence of many of the disease states that modern medicine is working so desperately hard to treat and cure. And as we've heard today, there are systemic and built reasons for that lack of equal care across communities in the United States and, of course, the world. Modern biological and digital technologies are not only offering us new solutions and opportunities to ensure that the care can and should be delivered to even the most medically underserved, but also offer new opportunities, tools, and technologies to monitor and identify who and at what communities are at the greatest risk of cancer and other ailments. Those requiring access to new medicines, trials, and new policies that are aimed to limit the external factors that drive unequal incidence of disease, for instance. Biological and diagnostic tools for cancer care and other ailments are becoming faster, they're becoming more powerful, they're becoming increasingly, they're being built on platforms that exist in a more distributed fashion that can enable us to rethink how we actually get that care and that monitoring surveillance tools out to communities. The acuity and scale of COVID-19 offered this current administration an opportunity to push forward some of these new technologies, particularly in medically underserved communities. For instance, in 22, the administration, after identifying that there were gaps in who was able to access care for COVID, drove a new program called the Digital Home Test to Treat program that eMed now implements and is supported by the National Institutes of Health, the CDC, and ASPR. And it leverages telemedicine and modern-day software and logistics platforms, as well as self-diagnostic tools and other tools to enable somebody to go from symptom onset to getting care and treatment delivered to their doorstep in hours after waking up, finding out that they're sick. So similarly, the intersection of digital health tools, distributed diagnostics, home sampling techniques, and cutting-edge disease-agnostic biological tools today make it possible to vastly accelerate the aims and goals of the Cancer Moonshot and ensure that these innovations reach all communities. Identifying which are at greatest risk will offer us opportunities to learn and vastly improve how research in cancer care resources can be distributed using those modern technologies. So new innovations in highly multiplex and highly distributed immunology, proteomics, genomics, diagnostics, and surveillance tools coupled with new technologies and understanding and describing environmental chemicals and risk factors. Coupling those to new AI tools offers us brand new opportunities to not only bring that new cancer care that's being developed and clinical trials to make that happen, but also importantly to do it with the greatest precision that can simultaneously inform policy to ensure that the resources, innovations of the Cancer Moonshot are being distributed most fairly. So we look forward to working with the National Minority Quality Forum and leading many of these efforts. This administration, organizations across the Cancer Moonshot programs and healthcare ecosystem help develop and identify and make the most important advances in healthcare and cancer research available to all Americans. Thank you.
So it's funny, I was getting the hook before I even got on stage. I'm Daryl Roberts, the CEO of Hessian Labs. We develop molecular diagnostics. We all envision a more democratized healthcare system, one in which we can deliver an equal level of healthcare in every place across the country. The problem with that with cancer, you can't do that with today's screening and diagnostics for cancer. You simply can't get there. To get to the future that we want, you need a couple of things. Cancer screening and diagnostic tools need to be early, accurate, affordable, and actionable. That's one thing. On the second side, therapies need to be safe. I was struck by my colleague from Sanofi saying that cancer treatments can get you sick. They need to be affordable, and they need to be effective. The issue now, so what's the problem with these diagnostic tools? They're built on a primitive paradigm, which says in order to identify this disease, we look at the evolving tissue, and we try and look at the evolving tissue through biopsy or multiple screening modalities. Those are expensive screening modalities, so you can't implement them locally. On the therapeutic side, simply the identification of cancer and treating cancer requires it to involve incredibly toxic therapies. And those toxic therapies cannot be delivered locally. You have to have them in a center because you may get sick from the therapy, so you need all of the subspecialties around. Treating cancer itself is ridiculously expensive. So you can't get to that future of more equitable, affordable healthcare today. So what do we need? We need diagnostics which are most effective, not diagnostics which simply look at the evolving tumor, either through biopsy or through screening tools. You need diagnostics which can tell you whether or not the tumor is advancing at a molecular level, whether or not there's onset or aggressive progression. And with those true dynamic molecular detail, you can then move to developing more effective therapies. Hessian Labs develops molecular diagnostics without the need for tissue. We can deliver the proteins which indicate the advance of disease from a healthy condition to malignancy. We look at and can see the dynamic proteins as they move from early stage to later stages. And more importantly, our ability to deliver these tools do not require tertiary or quaternary centers for them to be implemented. The intent is to have them be delivered locally. So we applaud Gary's effort and NMQF's effort to usher in a new phase of democratized healthcare, to usher in a new phase of more equitable healthcare. But to get to that future, we all need to come together to find better tools to be better implemented at the local level. Because if you only focus on tools and mechanisms which require a large-scale, expensive situation to be delivered. We will never get to that future that we all envision. With that, thank you, Gary. Thank you, everyone.
So I want to thank each and every one of the presenters. I think and I hope you understand that we opened the door to the future. And we're being very intentional about it. The brain power and the capacity in this room right now transforms American cancer care, period. This is about will. This is about being intentional. This is about saying we are leaving no one on the battlefield. We're going to figure this out. And we need your partnership. We're the agitators. NMQF has no doctors. We don't have a doctor on our staff, really, that's practicing medicine. Dr. Elise is doing research, but he doesn't see patients. But you do, right? You do. I'm going to leave you with this last word because I think it's really important in this moment. We have to learn to do big things together. Big things, big transformative things together. That's how we get deep into the 21st century. That's the moment we're in. And that's the partnership we're asking of you. Join with us. Let's work collaboratively. You heard those voices in Flint, in Houston. That's our obligation to them. That's the contract. That's the social contract. So anyway, I'm going to stop here. As you told me to tell the press to meet her over there, I want to thank you. We are going to assemble again tomorrow, and the intent tomorrow is to begin rolling up our sleeves, and let's try to do some really big things together. So thank you so much.